Welcome, everyone. Hi, I'm Rhonda Kessler from UUCSR. I represent the Caring Committee, which is a committee that takes care of the needs of the individuals who are members here at UUCSR. It's our ministry to reach out and care for those who have concerns, who are in need of any kind of help. We also, our focus is to really attend to any people who are sick or who need either phone calls, phone contacts, follow-up visitations, and so forth. I would like to really shift over, though, because our purpose here today is to present a very interesting discussion and talk called Generation RX. And we have a panel discussion today to present the topic of drugs and the elderly and the importance of management. And Kathy Samuels, who is here, who really organized and really put this whole presentation together, is from CASA, and she is going to present our panel at the present time. So thank you.
Since 2001, CASA has engaged the community to view underage drinking and substance misuse as a public health problem. Over the past year, our Cardinal Health Foundation Generation RX Safe Medicine Practices for Life grant has enabled us to work with multiple partners to educate residents to the importance of safe medicine practices in the prevention of prescription drug misuse. Today's program discusses how the prescription drug epidemic is rampant across Long Island and how it affects older adults and those who care for them. At this point, I would like to introduce our panelists for today's program. Risa Berg is a licensed master in social work and is Director of Education and Prevention at the Long Island Council on Alcoholism and Drug Dependence, also known as LICAD. As director, Risa coordinates and provides professional development trainings, conferences, assemblies, and workshops for communities, school districts, and social work agencies on Long Island, having done 440 presentations in 2016. Her team speaks to over 25,000 people on year with topics included healthy decision-making, substance abuse disorders, eating disorders, anxiety in the 21st century, mindfulness-based therapies, and social media and the digital age. Paulette Philippe is an advisory committee member for Families in Supportive Treatment, or FIST. FIST is a non-for-profit organization designed to organize, support, educate, guide, and provide resources to families who are struggling with a loved one's addiction. The FIST Advisory Committee represents a diverse cross-section of New Yorkers, including families impacted by the disease of addiction. We thank Paulette for being here today and sharing her personal experience regarding the loss of her grandson Gabriel to an opioid overdose. We welcome Richard Kaufler, who is a licensed clinical social worker with a psychotherapy R privilege and credentialed alcoholism and substance abuse counselor for geriatrics. Since 1999, his program, It's Never Too Late, has helped seniors struggling with substance abuse. His innovative program for older adults teaches seniors how to live and enjoy their lives without alcohol or drugs. And finally, we welcome Howard Jacobson, who is a registered pharmacist since 1979, owning 3 independent community pharmacies in Nassau County. Mr. Jacobson is president of the Long Island Pharmacists Society for the past 4 years and has been a contributor to the Nassau County Heroin Task Force. He is a graduate from St. John University's College of Pharmacy, where he currently participates as a preceptor for the St. John's College of Pharmacy, where his students work in his pharmacies to learn more about the operation of the independently owned community pharmacy. We will begin our panel discussion with Risa Berg from LICAD. Risa.
Thank you. Thank you for having me. My name is Risa Berg. I'm from the Long Island Council on Alcoholism and Drug Dependence. Today I'm really going to be talking about how we got here in terms of the epidemic. It didn't just start with heroin, and it oftentimes starts with alcohol, marijuana, prescription pills. So with today's focus being prescription pills, we're going to talk a lot about that. But unfortunately, I do want to start with some regrettable statistics about what we are seeing here on Long Island. These are the fatal overdoses here on Long Island for Suffolk and Nassau County. One of the positive things I do want to point out is that last year alone, 779 people were revived with Narcan. If you are not trained in Narcan, that's something I really suggest you looking into. If you know someone in your family who has been suffering with some sort of substance use, or if someone's using an opiate as prescribed, it's really, really important to get trained in that, and we can give you more information on that as well. In terms of the progression of substance use, it used to be that from first trying a drug, moving along from infrequent use, early abuse, abuse to full-blown dependence, where you're psychologically, physically dependent on a drug, it would take someone on average 6 to 8 years. What we're seeing in the last couple years especially is that people are progressing along this continuum in 6 months to a year and a half. And oftentimes when I do community forums, we all kind of speculate why we think that is. Oftentimes some of the reasons that we're thinking is stress levels higher than ever before, the need of instant gratification, right? I have an uncomfortable feeling, I'm feeling uneasy, I'm feeling insecure. I know that if I take this pill, I'll temporarily feel better, and I'll feel better right away. So that's something maybe as a society that we're starting to look at more and more, and something we're dealing with in treatment. Also the availability and the cost of a lot of the drugs that we're seeing misused and abused, and the age where people first start using drugs and alcohol. Though I will be talking a lot about young people in terms of kind of this progression, this is not a young person's disease. This is illicit drug use among adults age 50 to 64, and you'll see that all of those numbers are increasing. I personally have clients in their 60s and 70s who are struggling with the same drugs and the same feelings that some of our 20-year-old clients are. Right? So we really need to separate from thinking about this as a young person's disease. Oftentimes, the prescription drugs that we're seeing misused or abused fall into these three categories. Painkillers, so any of the opiates, benzodiazepines, so sedatives, tranquilizers, and then of course stimulants. Oftentimes drugs prescribed for things like ADHD, so Vyvanse, Concerta, Adderall, Ritalin, really, really commonly misused or abused. The thing I want to mostly talk about today would be the painkillers and the sedatives. The most commonly prescribed sedative here on Long Island would be Xanax or derivatives of. And one of the things about Xanax is that Xanax is a depressant, right? So it slows down our respiratory system or central nervous system. And when we combine that with another depressant, like an opiate, our breathing can regrettably slow to the point where we stop breathing altogether. And so many of the overdoses that we saw in the last 2 years especially were not always a fatal amount of one drug, but oftentimes a mixture of different drugs. So Xanax and an opiate, or oxy and alcohol, or heroin and fentanyl, right? So oftentimes it's mixing these certain drugs together. In terms of opiates, the most commonly abused opiates here on Long Island, oxycodone, Oxycontin, Percocet, Suboxone's become very popular. In the middle picture here, I have someone's palm holding blue pills. Those are Roxys. Those are the most commonly diverted drug here on Long Island on the street. And then on the right, I have Oxycontin. That's the most sought after drug on the street. You should know that these pills, depending on your neighborhood, typically go for about $1 a milligram on the street. So a 30 milligram pill should sell for around $30, right? And we know with the nature of tolerance that if you start with one pill, eventually you're gonna need 2. Eventually you're gonna need 4, right? And so this quickly becomes very expensive and very challenging to get. And in the early 2000s, there was a lot of people engaging in doctor shopping, going to one doctor and saying, I have leg pain, I need help. Then going to another doctor saying the same story or a different story. So now they have 2 prescriptions. They can either take one sell one, take both, or sell both. And so for a really long time, it was very easy to access all of these prescription pills on the street because this was a fairly easy practice to engage in. So LICAD, FIST, LIRA, LICAN, a bunch of grassroots organizations went up to Albany. We advocated for change. So in 2013, the internet system to track overprescribing, or iStop, went into place. So now when you go to Dr. A, they put you into a registry or a database. So when you go to Dr. B, they say, Risa, you're already prescribed. The pharmacy says you already had this filled. So now people can't really engage in this practice as easily anymore. And so what did this mean for people who are already using? For a lot of people who are already misusing or abusing prescription painkillers, they were left with one of two options. I can either go to treatment and get better, hopefully, or if I'm not ready for that, I move on to a very similar drug. You'll see up here OxyContin versus heroin are almost identical. And what's interesting is that when there's tons of prescription pills available on the street, we see the potency of heroin rise because they're meeting its competitor. If the OxyContin pill is 100% opiate, we're going to see the potency of heroin rise to as close to 100% as possible to match its competition. Currently, heroin potency sits between 80 and 90% as it fluctuates regularly. And what's important about this is that more and more people are able to snort the drug to feel the effect. Right? We all have these mental barriers. I would drink, but I would never smoke. I would smoke, but I would never snort a drug. I would snort a drug, but I would never use a needle. I would never be an injection drug user. And for most people, that's the biggest barrier. So if we're seeing that more and more people are snorting the drug, including older individuals, we're seeing more people more open to using heroin. Heroin here on Long Island is typically an off-white powder. We don't typically see black tar heroin here on Long Island. One of the things I do want to mention about the heroin is that in the last 2 years, especially, most of our heroin is being laced with fentanyl, which is a very, very powerful opiate. They say fentanyl is 50 times more powerful than heroin, 100 times more powerful than morphine. And so it led to a lot of overdoses here on Long Island. If you're someone that knew that you can handle 2 bags of heroin, but today you pick up those 2 bags and they're cut with fentanyl, that could regrettably be too much. So that's something that we're really trying to advocate and trying to talk to the community about in terms of harm reduction. We also encourage, as I mentioned before, people to become trained in Narcan. LICAD does free trainings in both of our offices, Nassau and Suffolk County, every single month, where you can come in and get trained and leave with a kit for free. So if you're interested in that, please contact LICAD at licad.org. So how do we know if someone has a problem with drugs or alcohol? Oftentimes, these are the things we're looking for. These are the areas of our life that might be affected. Physical health, right? Changes in weight, changes in hygiene, changes in health. So anything from jaundice to cirrhosis of the liver to Hep C, HIV. Interpersonal, so friends and family. Am I changing my groups of friends? Am I breaking up with girlfriend, boyfriend, husband, wife after the weekend? Am I distancing myself from my children or my parents? Emotional, how have I changed personally? Am I more moody? Am I more irritable? What's changed kind of in terms of my mood? Financial, how are we paying for the drugs? Right? Are we using our whole paycheck? Are we selling things? Are we selling ourselves? Right? Education, vocational, school or work, how has that been affected? Are your grades going down? Are you not showing up as often? And then lastly, craving. The last one used to be legal. So if you go out for a good time and end up in handcuffs, that's a bad sign. But we've replaced it with craving. Craving is essentially obsessions and compulsions around drug use. Obsessions being recycled thoughts, right? I need another, I need another, I need another. Compulsions being recycled behaviors. I take another, I take another, I take another. So if you see that someone has these issues, it's important to reach out for help. And it's also important to consider why someone uses drugs. There's a multitude of reasons why people use drugs: curiosity, peer pressure, but most commonly what we're seeing is that people are self-medicating something. They're coping with something. They're stressed, they're overwhelmed, there's some sort of uncomfortable feeling that they're trying to deal with. And so the cycle of substance use is I have an uncomfortable feeling, I don't know what to do with it. I know that if I take this pill, I'll temporarily feel better, feel nothing. I take that pill, but in order to take that pill, I have to take $20 from my friend's wallet. I don't go to work. I don't call my husband. I take the pill, feel better, feel nothing. I sober up. I realize all of my original problems are still there. And now my husband's mad at me, my mom is mad at me, my job is calling, right? I have all these additional problems. I don't know how to deal with that and the guilt and shame that I had to use this drug to feel better. So I use again. So treatment really teaches people how to cope with all of life's challenges and all of these uncomfortable feelings. LICAD does individual counseling. We help get people into treatment. We do relapse prevention. There's also a great facility, Seafield, in Manhasset. That's an excellent, excellent facility. So there are resources out there if you're worried about someone. I think the final thing I want to say is that people who use drugs are not bad people who need to get good. They're sick people who need to get well. And as a community, we need to come together and start talking about these things and reaching out and getting people the help that they need. Thank you so much.
Hi, everyone. My name is Paulette Philippi, and I guess you've all figured I'm a senior myself. And I like to say I'm a senior working on growing in wisdom. And I'd like to give you my definition of wisdom. It's knowledge, experience, and then growing from it. And you know, I feel like my life has been a lot of that. And I'd like to ask you a few questions to kind of make some points. If I told you I had triple negative breast cancer, how would you treat me? When I was diagnosed 2.5 years ago, people behaved with compassion, lots of concern, and offered to help in positive ways. If I told you my mother struggled with pain medication and became addicted, that our family is predisposed to alcohol or drug addiction, now called substance use disorder, that I married into it, I have a son who is in recovery, and a grandson that died of a substance abuse overdose. How would you feel about that? Is there a stigma that comes to mind? That happens a lot of times. Does this disease hold shame, a real shame piece? Or do you believe addiction is a disease like cancer? Think about diabetes and how someone struggles with losing weight. They do well by staying on a diet, exercise, and then they slip. This is harmful to a person's health, but they are not shamed and they're not made to feel less than. And I believe, as many professionals, that chronic addiction to drugs or alcohol is a brain disease, causing the person to crave the substance due to the brain's greatly amplified message to use in order to not feel pain or to cause a euphoric effect. And then there's that need to repeat this over and over again. So I'm really here to tell you a lot about or hopefully not too much that I go over. But anyway, tell you a little bit about my grandson, Gabriel. When he was 4 years old, Gabriel and his dad came to live with my husband and I after my son received custody. I helped to bring Gabe up, taking him to school, doctors, therapy, shopping for clothes, going to the movies, protecting and teaching Gabriel many life skills. Gabriel had a dry sense of humor, was inquisitive. He had a great vocabulary, always wanting to know what a word meant and how to use it. He also was very happy just watching TV and playing video games. He tended to drink lots of milk and fast. Gabe seemed to want more and more with a thirst for more than milk. I worked hard to get him play dates, enjoy the garden, dragonflies, even jumping on the trampoline with him, which was a challenge. Swim in the pool and play games. Gabe was a natural at sports, but was not interested in that. He loved music, played the guitar well, and liked to act. When Gabe went into 5th grade, he and Dad moved to another school district, which was kind of rough on him. He learned to find great friends after a while, and then Gabe appeared to have healthy friends or peers until about 7th into 8th grade. Around that time, I saw less of Gabe. He said he was getting older, and it wasn't cool to hang around his grandma anymore. But I felt like that was, part of his growing up, and that was okay. One time, I took Gabe and 2 of my grandchildren back to school shopping at the mall, and I was really excited about it. 2 teens approached Gabe, and after that, he seemed to have lost interest in clothes and asked for the money instead. Gabe always took a real interest in his appearance and loved fashion, so this greatly surprised me. Hindsight is always easier to see why he wanted the money and the teens were in the mall. Another time, I remember our whole family was enjoying a vacation in our log home in New Hampshire. Gabriel had his pants on a chair and they fell. As they did, I noticed on the rug was some money and what I thought was a piece of chalk. I picked them up and put everything back in his pocket. Later, after Gabe shamefully told me he at one time was using ecstasy, and because of this would need to take serotonin replacement the rest of his life. I looked up ecstasy on the computer only to find out that I had put this drug back in his pocket. I wasn't educated, and I put my other grandchildren in harm's way. It really, really touched me deeply. Now I know what opiates look like, and I question anything I am not sure of. I don't keep my medication in the bathroom. My meds are not easily accessible, and I am careful not to drop a pill, because my hands don't work quite as well as they used to, which that's the way it goes. I ask about anything new that is prescribed, and if it is addictive. I am my own advocate and make sure I educate myself, not afraid to ask questions. I also dispose of medications properly when they are no longer needed. I like to use I like to use meditation or painting, or possibly focusing on something other than my pain, or find out what the pain is telling me instead of a quick fix. Once we realized that Gabe was into this substance use disorder or addiction to drugs, he was lying, missing school, stealing, selling things precious to him, even his computer. And even clothes I bought him that at one time he was so into. I learned to make sure that I kept the receipts so that it would be hard for him to take anything back to the store to have money to buy drugs. It is a family disease, and we all need to get help. It was like getting on a roller coaster going up and down and around. Thank God I had found Al-Anon, was working hard on my program and the 12 steps with a sponsor. I was learning to put the focus on myself and take care of me. I could never stop loving my grandson, but I could sure hate that disease and what these drugs had robbed Gabe and our family of. I was choosing to pray for guidance and not get caught in the insanity. I did not want to be medicated to get through this. I chose therapy, meditation, prayer, Al-Anon, and people that understood. It still was a very dark time with conflicting messages on how we could best help my grandson. Gabriel, at the age of 15, overdosed for the first time on December 28, 2009. That was the birth date of my father-in-law that died an alcoholic. Gabe's dad put him in the hospital to try and get help, but the insurance company only gave him 8 days, saying he was ready for outpatient. When Gabe left the hospital, we had our real Gabe back, but that didn't last long. Our family, especially his dad, tried to get him into a rehab, but on April 22nd, 2010, at 15, we received that call to go to the hospital to say goodbye. On the anniversary of my mother's birth date, I held Gabriel's cold, lifeless hand one last time, not wanting to let go, knowing that this was the last time. How have I gotten through this? The first year was a blur. Then each anniversary of his passing, we as a family would try and educate others in his memory, hoping that we could help a family not have to go through the same thing we have experienced. From this, I found out about a bus going to Albany for a Mother's Day advocacy trip to try and get bills passed concerning substance abuse disorder and how best to help the ones struggling with the disease. On that magic bus ride, I found amazing women that had lost their loved ones to substance use disorder and those in recovery. We fought alongside of therapists to make changes. It was an empowering day, and we did make changes. I also met Anthony Rizzuto, founder of Families in Support of Treatment, on that amazing day. He stresses that it is a family disease, and the whole family needs to heal. If the person is in recovery and he goes back to the same environment or dysfunction, nothing will change. Everyone needs to be in recovery of some kind. So to help me heal, I am a grateful member of Al-Anon. I work the steps and I have a sponsor. I am on the advisory committee of FIST, and our FIST family is a loving family in that we work together, we laugh together, we cry together, and we make a difference. I facilitate Alateen. I work 2 days a week in a job I love. I'm married 52 years, and we enjoy doing things together and have our own friends. And we do disagree, there's no doubt about that. I have 3 children that I enjoy being with and spending time with, but they also have their separate lives. I have 8 grandchildren, 1 angel grandson. They are all a little different, but I love them in their individuality. And I have a great grandson on the way. Do I miss my grandson? Yes, sometimes I can hardly stand the grief. But then I try and I quiet myself, and I sense Gabriel telling me that he is close. He is in my heart, and no one can take away the good memories we shared. Excuse me. Thank you for listening.
Just to let you know, chemical dependency, alcoholism, all of these things are the same. Alcohol is a drug, and that's how we treat it in the field. Alcohol is a drug. Nicotine is a drug. If you experience withdrawal, our feeling is, and you will with alcohol and or cigarettes or 100 other drugs, it is a drug problem. Now, we can call it alcoholism, alcohol abuse, alcohol dependence, alcohol use disorder. I mean, there's 100 different names for it. A person who's drinking needs help. I've been doing this, I guess, since 1990, when I was out actually in school at South Oaks out on Long Island, and I sat with a woman who was in her 70s, and she was alone, and we had group and everything else there, and she just didn't relate to any of the other people that were there. There were people in their late teens, 20s, 30s. If you were lucky, you got a senior who was in his 40s. I mean, she really did not fit in it, and we sat and we spoke and we spoke and we spoke. And I guess the best part of it is that she eventually found AA. I'm not endorsing any program, but if it works for you, go for it. And she did well for herself. But what I noticed was there were no groups for older adults. They just weren't there. And I started doing this back in 1991 for the city of New York, actually, helping them out with the program. And we used to go into senior centers. Now, we had people there taking OxyContin, smoking crack, smoking pot. I got to say, the biggest part of our treatment was socialization. You know, when you have socialization, people close to your own age in the same situation, the groups are amazing. But the numbers were unbelievable. And then did it again at another hospital for the city of New York and said, let's come up with a name for this. You know, we're looking at all these people coming in here, and now all of a sudden they're the majority of the people in treatment, not the younger people. And it really threw everything for a loop. We came up with It's Never Too Late. I've been working with older adults for a while. I think it's so important that people know. I mean, there was a PowerPoint that I could have done. There's so much to discuss in a short period of time. But if you don't know what's going on in someone's house, if you don't know what they're doing, I mean, how do you know what's really happening? No, it can't be my family or one of those things. You know, it can't be us. It's not me. It's never going to happen to me. It'll never happen to me. You know, and I'm sure Gabe also. You know, terminal uniqueness. It's not going to happen. We were getting our clients a lot coming into the emergency room with broken limbs, broke their wrists, broke their arm, falling down. And what happened was the physician said, you know what, maybe we should start taking some blood alcohol levels because I think I'm smelling alcohol in a couple of people. And the alcohol levels were through the roof. And, you know, I'd walk through the emergency room, and I got to tell you, I think just about every hospital, anywhere in the country, you may come in with one diagnosis, whatever it might be, you know, seizure disorder, but underneath, let's find out if the person was drinking. Let's find out, you know, you really need to explore, peel away the onion, and that's how we got a lot of people into treatment. The reason I work where I did is because someone said to me, you work with the most vulnerable people. And, I mean, I guess that's part of what goes on. I love the clients I work with. You know, quoting a detective from Long Island says that alcoholics and addicts are the best people in the world when they're sober. So I continued working with them. I actually have been retired now for, I don't know, 50 days, 49, who's counting? Anyway, but I'm not completely retired because I do my own private work out here. I do trainings. It's an epidemic. Older adults don't fit in with younger groups. They want to be spoken to like they're adults. This is a crowd of people, population that is so funny, have so much wisdom. When they get together and they finally, you know, it doesn't matter religion, color, I mean everything, and they sit in a group. It is so cool to watch. I know it's kind of hard to see it up there, but exchanging numbers, having people come back to the group who've graduated and let them know they have a chance. But the doctor gave me these pills, so they're okay. Yeah, I know, but the problem is, you know, you're supposed to take 2 every 4 hours. You don't take 4 every 2.5 hours. And I tell you, when you're sober and these people get sober, my clients get sober, and it's like the best feeling in the world. And I asked them, is there a time in your life where you can go ahead, reminiscence groups, look back, when things seemed like they were going well, you felt in control of your life, things were happening, and every person will say, yes, absolutely, Richard. I said, do you think it's possible that you can get there again? And they said, I'd love to. I said, you will. no more, I think I'll try, I might be able to do it. No, you will. The most consistent clients in treatment, always there. I did groups with them forever, it seems. And that was the hardest part of, retiring, to leave the clients. But if you've ever had a meal that didn't agree with you, I know this always goes over well when I speak, and your stomach starts to bother you, and then you realize you need to leave the event or wherever you are, and I'll see you later, I got to go someplace. So what I'm talking about, obviously, your stomach bothers you, got to run to the bathroom, okay? And I would say to you, just don't go. Use your willpower. The reality of it is when the obsession and the compulsion to get high comes across to an addict, they will drag a tree out of the ground, they will do whatever they have to do, no matter what, to get their hands on that substance. It's brain illness. 95% of addiction is in the brain. We know that. So we go ahead and we work with people to change their thinking and hopefully change their behaviors. This disease is always going to be there, always in someone's body. They will have it forever. The other part I want to make is about Xanax. We used to call Xanax Valium in the old days. It's a drink in pill form. That's exactly what it is. You take a Xanax. I don't know if you've ever seen The Wizard of Oz, where the Tin Man got his oil and he was like, yo, I'm feeling good, things are okay now. Well, that's what happens. And they are the most abused, I guess, benzos out there. It's just a horror what we see. I don't want to just go on, but I got to tell you, any questions at all, anything, my card is up here. I am available, and I mean that. If you want to email me, you want to call me, absolutely. And I want to thank you for having me here today. I really do appreciate it. Thank you very much.
What a panel. I'm honored to be among this group, and thank Kathy and CASA for having me here today. And I hope what I have to say isn't too repetitive. I am a registered pharmacist, been so, as Kathy said, for a couple of years. I am by no means an addiction or an opioid or a therapist or a specialist in that field, although, as Kathy said, I am on the Long Island Heroin Task Force. I'm very proud to say that my society was instrumental in, along with a lot of other great groups, in getting the I-STOP legislation passed a few years ago. And as a practicing pharmacist in the pharmacy every day, I too can say that it has certainly curbed doctor shopping. What else it's done, I guess that'll be seen in the future, but doctor shopping has definitely plummeted. America is 5% of the world's population and uses 80% of all opioids produced. And it's estimated that 2 million Americans are addicted to opioids and another additional 500,000 addicted to heroin. So what's the problem? Opiates are a great pain reliever, but they're not really good for much else. They have many side effects, from constipation. Now there are even drugs, if you watch the Super Bowl, drugs to treat opioid-induced constipation. I actually did fall out of my seat when I was watching the Super Bowl. To sedation, as has been mentioned already, respiratory depression, and withdrawal symptoms when somebody gets abruptly discontinued from using opiates. Many Americans suffer from chronic pain issues. Who here doesn't or hasn't? However, there are no long-term studies that demonstrate the chronic use of opioids outweighing the risks. The benefits have not been proven to outweigh the risks of using them. Plus, when a patient starts using opiates on a regular basis, the body produces less of its own endogenous chemicals that fight pain. And that's why when someone does go off an opiate abruptly, their own body doesn't have the chemical to replace it. They go into withdrawal. So we have use versus misuse versus abuse. And as a pharmacist, I see it all the time. We are We are the front lines of patients getting their prescriptions for the medications. According to the CDC, 80% of all heroin addicts started out on prescription opiates. And overdoses have become the leading cause of accidental death in America. And I don't know if anybody saw this a week or so ago in Newsday. And it's like every other day. Every other day. Every day there are articles about opiates, the havoc they're wreaking on our society. There was a new law. We were talking about 2016. There were over 500 deaths on Long Island and 30,000 nationwide due to all opiates, illicit and illegal and illicit. New York recently passed a law that the first prescription for acute pain, the maximum supply is 7 days. That's a brand new law, started January, and there is even a proposal by Assemblyman McDonald, who is actually a pharmacist, to cut that back to even a 3-day supply on the first prescription for an acute pain being treated with an opioid. And by July 1st, every prescriber in New York State who has a DEA registration will have to have certified that he or she did a 3-hour, it's not much, but it's more than it was, and it is an awareness thing, a 3-hour course in addiction, pain management, and palliative treatment. So where does that bring me? Naloxone. Pharmacists are being trained as how to show how to use naloxone. There are so many naloxone classes, and now naloxone is, I'd have to say, much more freely available. I counsel people that if you're using opiates, if you know of somebody using them legal or illegally, it would be good to have that around. How many lives could have been saved? And so many lives have already been saved due to the naloxone trainings. Well, Kathy definitely wanted me to mention Generation X. Being a pharmacist, we are now putting these in all our packages when we dispense medications to patients, opiates or not, safe medication practices. And she did want me to mention that. I guess I could have just put this up here and everybody could read it, but they are so true. Only use prescription drugs as directed. Read the label. Talk to your pharmacist. Pharmacists are the most visited healthcare professionals. People come to a pharmacist at least 10 times more than they do to a doctor. And pharmacists are full of knowledge. I brought one of my students here. They go to school for 6 years now. They know a lot. So talk to them about the prescriptions that you're getting. Never share your prescription drugs with somebody else. They're for you. Always store your medications, particularly abusable substances, but all substances. Store them in a safe place, know where they are, maybe a locked cabinet. And if you have extra medication that you didn't use, don't save it. Let me make a living and redispense it to you if you have to use something again at a later date. That was a little bit of a joke. And there are, every police station, I'm also on the Long Island reclamation, water, having to do with our water supply and whatnot. You would be amazed as to what we are finding in our water supplies, from opiates to hormones to any number of substances in our groundwater here on Long Island. Every police station on Long Island has a drop box. And police stations are open 24 hours a day. To me, that's the easiest way. And right now, we are in the process in the state legislature of passing legislation to mandate that chain pharmacies have boxes in the pharmacy, and that mail-away pharmacies offer every patient in New York State the opportunity to send them back the unused and unwanted drugs, because these drugs are obviously getting into the wrong hands and into our water supply. So I think those are some very good initiatives on the way, and I think that's about all I have to say.
Thank you so much. We want to thank our panelists today. Thank you for being with Prevention Through Connection. And just as a reminder, every Nassau County Police precinct has a disposable box in their lobby. Please feel free to drop your medications at the precincts. Thank you for watching.